Here's Module 18, Nursing Care of Patients with Neurodevelopmental Disorders. Go ahead and take a few seconds to read your learning outcomes. Neurodevelopmental disorders are not easily diagnosed in children, and this can cause a delay in treatment. It affects their home and school environment and can interfere with peer interaction. Behaviors can be pathologic. Behavior is considered pathologic when the behavior is extreme and presented as unacceptable. They may also have very powerful feelings that they cannot control. This makes their behavior not age appropriate. They may deviate from cultural norms or create deficits for impairment in functioning. You also have your attention deficit hyperactivity disorder, which is also known as ADHD, your autism spectrum disorder, your intellectual development disorder, which we won't be focusing on, and your specific learning disorders, which we will not be focusing on. Make sure you look in your ATI mental health book. It should be on page 257, chapter 26. If it's not, let me know. I know we got new books this time, so the page numbers may be a little bit off. When you look at your autism spectrum disorders, these are typically recognized during the second year of life. Autism is about 1% of the population. Etiology and risk factors. You have your genetics, your biochemical, social and environmental, cultural and ethnic, resiliency, and traumatic events. In general, neurodevelopmental disorders have these risk factors. We will look at them individually on the following slides. Biochemical alterations in neurotransmitters, marriage problems, low socioeconomic status, large families, parents with criminal histories, lack of cultural role models, effective coping strategies, and physical or sexual abuse. Those with ADHD are unable to control their behavior when attention is required. The behaviors are shown around age 12, but I have some statistics that show that symptoms could first appear between ages 3 to 6, and then from 6 to 12, they're actually diagnosed. It can be present in more than one setting. The child has trouble concentrating or focusing, or they have difficulty staying organized. They forget what they're doing or forget about completing a task or have difficulty sitting still, and this happens anywhere, at home, at school. You have your inattention, impulsivity, and hyperactivity. And with your inattention, they're unable to listen, pay attention, or focus. Their impulsivity, they're unable to wait for turns, consistent interruptions, acting out without considering consequences. In your hyperactivity, they're fidgety, unable to sit still, inappropriately running or climbing, excessive talking, unable to play quietly. There's two types. There's ADHD, predominantly inattentive, and ADHD, predominantly hyperactive, impulsive. Here's just a little picture of kids with ADHD and how they feel. You can see the first one is what society thinks I do, what teachers think I do, what my mom thinks I do, what my friends think, hey look, a squirrel, what doctors think I should do, and what I really do. So these kids are under a lot of stress, even though they're very hyper and they can't calm down and they're all over the place. This is something that they can't control. So even though society thinks that they should be able to stop it, or they should be able to control it, or they should be able to take a medication that will completely stop it, there's a lot of stress on these children. Here are a few more facts to know about ADHD by the numbers. Boys are more likely than girls to be diagnosed with ADHD. In a recent EmpoweringParents.com poll, 60% of the respondents said that their kids are taking medicine for ADHD, and 64% have tried some form of child counseling. Children ages 3 to 17 are diagnosed with ADHD. That's about 5.2 million. And child prescriptions for ADHD drugs climbed nearly 50% from 2002 to 2012. Nursing care for ADHD should be calm and firm, modeling. They need attention. They need to know that there are limits. Physical activities. They need positive reinforcement, positive feedback. Therapy may help these individuals. It could be group therapy or individual therapy. You need to work with their coping mechanisms. Medications can include central nervous system stimulants, norepinephrine, selective reuptake inhibitors, tricyclic antidepressants, or your alpha-2 adrenergic agonist. Make sure you go back and look in your ATI book, as I told you before. What I'm seeing here is page 26 through 27. But as I look back in your syllabus, ATI Mental Health is chapters 25 and 28. So you may just have to look for the chapters there to read that material. It's just a little cute cartoon about ADHD that you can read. When looking at ADHD medications, this slide talks about what stimulants are used to treat ADHD. Make sure you take the time to read over this slide, look at the medications and the different classifications that the medications are associated with. We're looking at ADHD central nervous system stimulants. The purpose is to increase norepinephrine, serotonin, and dopamine. Your side effects include insomnia, restlessness, weight loss, cardiovascular effects, withdrawal, psychotic manifestations such as hallucinations or paranoia, skin sensitivity and medication interactions. Precautions, you could result in substance abuse, cardiovascular problems, anxiety, psychosis. Things that can interact with these medications or make the side effects worse would be your caffeine, your MOAIs or your hypertension medications, your Dilantin, your Coumadin, and possibly some over-the-counter cold medications. When talking to patients or parents about medications, they need to understand that extended release tablets should not be chewed or crushed. They should take these medications on a regular basis or a regular schedule. If they're taking a patch like Daytrana, they need to apply it to one hip daily. That hip needs to be alternated every day. It is a controlled substance, so they shouldn't be sharing the medication with anyone else, and they are at a high risk for substance abuse with these medications. Make sure that you go back and look at slide 11 for those drugs that I showed you. You should be able to see the different classifications, and Ritalin is one of the drugs that are on there. One of our next classes of drugs for your ADHD is your norepinephrine selective reuptake inhibitors. The purpose is to block reuptake of norepinephrine. Your side effects include anorexia, weight loss, growth suppression, GI problems, suicidal ideations, and hepatic issues. One of the drugs that are considered a norepinephrine selective reuptake inhibitor is your Strattera. Precautions include Paxil, Prozac, quinidine, and your MAOIs or your hypertension medications. These drugs shouldn't be mixed with your norepinephrine selective reuptake inhibitors. And then in your nursing concerns, you want to make sure that the dosing and timing is correct, that they get their medication on time, and that they understand that it could take 1 to 3 weeks for the medication to take effect. Now we look at our tricyclic antidepressants. The purpose is to block the reuptake of monoamine neurotransmitter, norepinephrine and serotonin, and increase the effects. Your side effects include weight gain, orthostatic hypotension, sedation, and toxicity. Your precautions that you want to be careful with are your MOAIs for your hypertension, your antihistamines, alcohol, benzodiazepines, opioids, epinephrine and dopamine, seizures, liver, kidney, respiratory, and hypothyroid disorders. You can read more about your Elavil and your Norepinephrine on page 1360. It talks about your tricyclic antidepressants, and also you need to go back into your ATI book and look over tricyclic antidepressants. Tricyclic antidepressants should be taken daily. The slide says it takes 1 to 3 weeks for a therapeutic range to occur, but 1360 in your book says that it takes 6 to 8 weeks for therapeutic effects to occur. So we're going to go with what the book says with 6 to 8 weeks. These medications should not be stopped abruptly. Overdose can cause fatal arrhythmias, so clients should understand that it's easy to overdose on these medications and that they should be taken as prescribed. When we talk about autism spectrum disorders, it's a lifelong neurodevelopmental disability, abnormality of brain development and function. Prevalence is 1% of the United States population and is diagnosed 4 times more in males than in females. ASD is complex neurodevelopmental disorder. It's likely to have multiple etiologies, including genetic factors. A range of studies have found that 10 to 37% of cases there may be an associated medical condition such as tuberous sclerosis, Fragile X syndrome, maternal rubella, or Angelman syndrome. And if you're interested in knowing about any of these syndromes, you can look them up on the web. Also, abnormalities are seen in the frontal lobe and the amygdala. This controls emotions in ASD clients. Some genetic links or chromosomal abnormalities associated with autism and ADHD. Hereditary links range from 37 to 90% based on twin studies. Environmental risk include advanced prenatal age, low birth weight, and fetal exposure to Depakote, an anti-seizure medication. The behavior is characterized by deficits in social communication and social interaction, restricted repetitive behaviors, interests, and activities. That's the RRBs. They have communication deficits. They respond inappropriately in conversations. They may misread nonverbal clues. They have difficulty making friends or developing friendships. They're overly dependent on their routines. They're highly sensitive to change. And they intensely focus on inappropriate items. Difficulties include sensory integration dysfunction, sleep disorders, digestive and feeding disorders, epilepsy, and allergies. For your therapeutic measures, early intervention services, you want to improve the child's development as early as possible, help them learn important skills. The applied behavior analyst, this encourages positive behavior and discourages negative behavior. You have your speech therapy, your occupational therapy, and your sensory integration therapy. Your occupational therapy helps with your ADLs and your coping with sensory information. With your medications, this may help with the inability to focus, depression, seizures, or high levels of energy. And then your referrals, you want to make sure that you refer them for counseling or whatever medications that they may need. Functioning can range from poor, which is unable to care for themselves or communicate, to high functioning, where they can do many things on their own. Those with impaired social interaction, they should be assigned consistent staff, provide positive reinforcement for patients' voluntary interactions, provide direct feedback about patients' interactions, help patient learn to respond more appropriately in interactions, and give positive feedback for eye contact. The review questions look very similar to the ones that we did in Module 17. So we're going to skip over those. You can look through them if you would like, but I'm pretty sure these are the ones that we just did. I know a lot of this information is not in the chapter. You can find autism spectrum disorder on 1372, and of course some of the medication list that we had already discussed in the book, but make sure you look in your ATI book and follow those chapters on some of the other disorders.